Hi everyone, let's talk about the carotid sheath. In this video, we'll discuss the carotid sheath, its contents, and its associations with other structures in the neck. So the carotid sheath is a combination of condensations of various deep cervical investing fascia. So in the cross section of the neck here, we can see this represents the outermost boundary of the carotid sheath, and it's going to invest in around the neurovasculature. And it tends to be thicker surrounding the arterial aspects of the sheath and a little thinner about the venous aspects of the sheath to allow for blood flow in the veins. Here, laterally, I'll outline the contents of the carotid sheath. See it descending down in the neck. And crossing the carotid sheath here is the superior belly of the omohyoid muscle. Reflected away is the sternocleidomastoid muscle, but as we can see, it would be attaching down here. So the carotid sheath would be deep to both the SCM as well as the omohyoid. We can see other infrahyoid muscles of the neck here. So the carotid sheath is going to be lateral to those muscles. It's also going to be, if we look over here on the cross section, there's the trachea, and esophagus, and then there's the thyroid gland. So it will be lateral to those structures as well. We can, let me erase some of this so that we can see a couple of additional structures in here as well. So on this particular drawing, we can see the cervical sympathetic trunk on that side and on that side, and we can see that the carotid sheath is anterolateral to that. And we can't see it on this illustration, but let me just draw it in right there. The limbs of the ansa cervicalis are sometimes embedded in the sheath, and sometimes they're a little anterolateral. On this photograph, we can see there's the anterior limb of ansa descending, and then there's the posterior limb of ansa cervicalis. Some sources will say that the ansa cervicalis is a content of the sheath. Some will say that it's upon the sheath, and some will say that it's outside of the sheath. I think that these contradictions are more a function of anatomical variation than they are a true disagreement. So let's take a look at what all can be found within the carotid sheath and their various relationships to one another. So starting medially here, this is typically a very prominent feature of the sheath. We have the common carotid artery. The common carotid artery is a medial feature of the sheath. It's something that is very heavily invested by the fascia. That common carotid artery is going to bifurcate into external and internal carotid arteries, and the internal carotid artery is going to continue superiorly within the sheath, whereas the external carotid artery originates within the sheath, but it quickly moves anterior to it and leaves. Laterally, we have the internal jugular vein. So IJ is a lateral function within, going down. And nestled between IJ and common carotid is the vagus nerve. Vagus is posterior to these elements and oftentimes nestled between the common carotid and the IJ. If we think about this sheath extending up to the base of the skull, vagus and IJ are coming out of the jugular foramen. Think about what other structures are going to exit that foramen as well. So jugular foramen exiting the skull, cranial nerves 9, 10, and 11. Glossopharyngeal, vagus, and accessory nerve. So glossopharyngeal and accessory nerves are going to exit the skull within the carotid sheath and then exit from the carotid sheath. Also, in very close association with IJ, we'll see deep cervical lymph nodes, and you can find the jugular lymphatic trunk associated with those deep cervical lymph nodes. The lymphatics in the neck are very tightly associated with the IJV. So, question for you to round up our discussion of the carotid sheath. Which lymphatic trunk may be found within the carotid sheath? Perhaps this is a softball for you. Now let's think about the arrangement of lymphatics in the root of the neck. So we're going to have a right lymphatic duct on the right side and the thoracic duct on the left side. And these ducts are going to receive trunks in at the venous angles. So the right goes into the right venous angle. The thoracic goes in the vicinity of the left venous angle. Those venous angles are where the internal jugular veins meet the subclavian veins. So there are 3 trunks that conceptually feed into these ducts that feed into the vicinity of the venous angles. There's going to be subclavian trunks on either side. There will be jugular trunks on either side. And then ascending the thorax, there will be bronchomediastinal trunks. And these trunks may independently enter into the vicinity of the venous angle, but conceptually we have them going into ducts. And so within the carotid sheath would be the jugular trunk. Correct answer is B. Okay. Thank you for your time, all.